I meant to record the meeting. So, so again, I will just reiterate that this is for the screening and transition of care tools. So again, so the state has not released the final versions of the tools. However, we do expect them within hopefully the next few days. And then full implementation, like I said, well, implementation will begin January 1st, but the state anticipates fluid implementation of the tools in the first quarter. So that would be January, February, March of 2023. CCHP and CCMHP, so the Contra Costa Health Plan and Contra Costa Mental Health Plan, have been working together over the last several months to develop this implementation. So it has been a work in progress. Just wanted to go over some definitions because we do tend to use a lot of acronyms and everybody may not be aware of those. So CCHP, Kaiser, and Blue Cross, they are the managed care plans. So that would be MCP. CCHP and managed care plans, they deliver non-specialty mental health services, as you all probably know, as mild to moderate services. CCMHP is the mental health plan, and CCMHP, the mental health plan, delivers specialty mental health services and what you all know as moderate to severe. And then individuals receiving services through the managed care plan, they are often referred to as members, whereas individuals receiving care through the mental health plan are often referred to as beneficiaries. So I know it can get very confusing, and that's why I just wanted to kind of put it out there, that those are some of the definitions. Okay. So this transition, the screening and transition of care tools, they are meant to help everybody make sure they have access to care in the right place and the right time. The screening tools are meant for new individuals. So they have not been seen before. They're not currently receiving services. They are the ones who would be eligible for the screening tool. Now, the transition of care tool, that is what occurs when we're looking to transition care from one delivery system, so either the managed care plan or the mental health plan, to another delivery system. So obviously the individual is in care, whereas the screening tool is they have not started yet. Okay. So we'll go over the universal screening tool first. As mentioned, and we'll just continue to pepper this throughout, starting January 1st, which is 2 weeks away-ish, we will have the new standardized screening tool implemented across the state. So every county in California will be using the same tool. Information on the tool can be found within Behavioral Health Notice 22011, which I have attached at the end of the training. And there is a draft information notice, the Adult Screening and Transition of Care tool, for anybody who would like further reference. There is also an all plan letter that is under the managed care plan, and that is APL 55. I have that at the end of the training. I think it's the numbers at the end of the training, but there is a corresponding all plan letter. There are 3 tools: the adult screening tool, which is for anyone 21 and over; the youth screening tool for anyone under the age of 21; and then there's a youth screening tool for a parent or caretaker, someone calling on behalf of that youth. The access line will primarily be using the screening tool. So that's what we anticipate is most of the screening will be done through the access line. Screening is not required for anybody that contacts providers directly. So if somebody calls a provider, but they haven't been screened from the access line, the provider does have the ability to jump into the assessment. We're not necessarily advocating for that, but that is a benefit of the individual who's calling. So you wouldn't be doing the screening as a provider, you would jump into the assessment process. So development of the screening tool, the state has been working on this, and so they beta tested. 91% of the administrators agreed that the score referred the correct service delivery system. The average time for administration, and that was about 12 minutes. And with the youth tool, they beta tested that as well, and 93% of the administrators agreed that the score reflected the correct delivery system. The average time for that screening is 15 minutes. So what is a screening? It's really the first step to get an individual into care. It's used to quickly determine, so it's not a full assessment. It's not an assessment at all. It is what it says. It's just a screening. It should be completed in one encounter, and it can be completed by either clinical or non-clinical staff. If non-clinical staff are completing the screening and something does occur within the screening that does require a clinician, then a clinician would be called in to complete. I don't know why. So screening occurs at the point of access, and as we mentioned, we anticipate the access line will continue to provide the screenings as they have been. However, as mentioned, anybody can access care through several different ways. So if you as a provider receive a call from an individual and they have not been screened from the access line, you still have the option to gently refer them back to the access line for that screening. Or, as I mentioned before, you could agree to treat that individual. And so in that situation, you would complete the screening, and then you would reach out to the care management unit or CCHP.
Hey, Gina, just a quick clarification. I think you meant to say the provider would complete the assessment.
Yes. Oh, did I say screening? I apologize.
Yeah.
Yes,
Yeah.
The provider would complete the assessment and not the screening. So a screening would not be required in that situation. Thank you. So levels of distress. So based on the screening, the appropriate delivery system will be identified. And the two delivery systems are the non-specialty mental health, which AKA mild to moderate, and that would be through the managed care plan. And then there's the specialty mental health, which would be moderate to severe, and that would be the mental health plan. Okay, any questions regarding the screening tool? No? All right. Okay.
Katie, Gina.
Yes.
Yeah, question. Can you go back to the previous screen? So if somebody, oh, I just lost my thought. Non-specialty mental. Okay. So if somebody is moderate to severe, but they are CCHP, in other words, they have the Kaiser or Blue Cross managed care, are we not to take them?
No, so the mental health plan is responsible for all individuals who are moderate to severe. So yes, so most of those moderate to severe individuals do have CCHP, but since they're moderate to severe, they fall under the health plan and not the managed care plan.
Got it. Thank you.
I know, it's all very confusing. Okay, all right, any other questions? Okay, so we will jump into the Universal Transition of Care tool. So from the screening, that's where the individual is referred to either specialty or non-specialty mental health services. If within the delivery of those services, there's a change in symptoms and either a new service is needed, or I'm sorry, yes, a new service is needed, or they want to add a service, then we would, and we're going from one delivery system to the other. So this is where it's confusing, and I do have examples. Then the transition of care tool would be used. So the tool is meant to be the communication between the managed care plan and the mental health plan. The provider will determine whether a client's change in symptoms indicates that they need services through another delivery system. So we are relying on providers as clinicians to make the determination as to whether or not the change in symptoms warrant a change in delivery system. If there is a change in symptoms, but a new or additional service is not needed, then the transition of care tool is not indicated. So if there are changes, but you as the clinician are staying with that individual and continuing to treat them, you would not need to do a transition of care tool because you're not transitioning. So a step up example. So this would be an individual who's receiving services through non-specialty mental health. So a CCHP telehealth provider is providing individual therapy. And like I said, that's considered non-specialty mental health. And then during the treatment, the client's symptoms increase in severity, and the telehealth provider assesses the client is no longer appropriate for non-specialty and now needs specialty mental health services. So that's a scenario where the CCHP telehealth provider will complete the transition of care tool and they would submit it to the mental health plan. Step down example. So an individual is receiving services through one of the county's mental health clinics for individual and psychiatric services. So that would be considered specialty mental health. And then over the course of treatment, they improve, and the clinic is now assessing that the client is ready to step down and receive non-specialty mental health services. So they still have impairments, but their impairments have definitely improved and could now be treated through a lower level of care. So as a result, the mental health clinic would complete the transition of care tool, and they would submit to the managed care plan in order to initiate services through non-specialty. Okay. So the transition of care tool itself, it's used twofold. So it does have demographic information, providing some of the basic details, in addition to clinical information. The transition of care tool will document the referring plan and care team, as I mentioned, demographics, contact information, presenting behaviors, symptoms, environmental factors, behavioral health history, medical history, medications, and I'll go over the form itself. And then the services that are being requested. So you would identify what is being requested. You also have the option to attach anything. So if you have any treatment plans, medication lists, anything additional that would help the receiving provider, then you are able to attach that as well. Okay. So care coordination, that's the big push of all of this, is that we want to ensure that connections are being made. So part of this initiative is providers must coordinate with one another to facilitate. So, you will not just complete the tool, submit it, and then discharge the client. You will need to hold the client until the transition is completed. As such, you should continue to provide any necessary services during the transition, and you should be working with the client. And so it shouldn't be a surprise to the client that they've been transitioned to another provider. And so make sure that the client is definitely part of this decision-making process, and they're well aware of what's being recommended, what's being implemented. And then part of this, and actually a requirement from DHCS, is the provider needs to make sure that loop is closed. So what is the process for that? So like I mentioned earlier, the transition of care tool is only needed when the client symptoms have changed, and you will be either discharging or requesting an additional service from another delivery system. So like I said, managed care plan to mental health plan, or vice versa, mental health plan to managed care plan. To ensure this is an appropriate transition, at least in the very beginning, we are asking that everybody consult. So for our network providers, you would contact CMU as usual. For our CCHP telehealth providers, CPN, and then clinic CBOs, they'll be contacting the access line. And it's really just a consultation to make sure that the medical necessity criteria is being met. We don't want to initiate transitions that may or may not be accepted by the other delivery system. So we do want to make sure, at least in the very beginning, that we're all have the same understanding. And then if after consultation, it's determined that yes, it is appropriate for the transition to occur, you would complete and submit the form. And then if you're discharging, please continue to see the client until the new provider starts. And then once services do begin, there's actually a questionnaire that's being developed, and then you would submit the discharge form as usual. This is the form itself. So it's a 2-page form. In the beginning, we will have you submit the form, and I will go over this in a little more detail on the next slide, either paper form or through CRM. We are hoping to build it out electronically, but for now, it's a paper form. Okay. So as I mentioned, we are working to get it into Provider Portal or Epic, and so that you'll be able to access it that way. Once that's in place, we'll send out an update with a tip sheet. So we're not there yet. For our network providers, submit the form through Provider Portal. That's the preferred way. And you would use a subtopic BHS other. As you know, I always say in all the trainings, you can choose any subtopic. It's just if you choose the correct one, it goes to the right place immediately. Whereas if you don't, it may take a little while to get there. For the CCHP telehealth providers, you will submit the form through secure email. And for the CPN, you will submit the form to the access line through secure email or fax. So next steps and resources. For our network providers, please reach out to provider services at the CMU provider.services@cchealth.org, and we will do our best to answer any questions you have. For the CPN and CCHP telehealth providers, please email the mentalhealth.access@cchealth.org email address, and somebody will respond to you as well. There are upcoming DHCS webinars, and so if you would like to enroll in any of those webinars, there's the BH CalAIM webpage. And that webpage also has, just like I said, their timeline, the CalAIM initiative overall. So if you're curious and want more information, that's a good resource. There's also CalMesa. And Katie, I forget what the MHSA stands for. Mental Health Services Act. Is that
California Advancing, wait a second. Oh, CalMesa. I thought you were talking about.
Mental Health Services Act. It's the accountability organization associated with the act.
Yeah, I can never remember what the stands for.
I know, that's why I'm like, I don't remember. So they are also an additional resource, and they have LMS trainings and webinars. And so if you're interested in that, there's a link. And then, as I had mentioned earlier, there is the information notice. There's the all plan letter 22-005 that you may look to as well. After the training, we'll actually, for the network providers, we will be posting this PowerPoint on our webpage. And then we may also email it out to everybody. For CCHP, I'm sure that they will also be looking to disseminate the PowerPoint for anybody who didn't attend the training. But we'll, definitely work on getting this out to everybody as well. Okay, so any questions on the transition of care tool?
Yeah, Gina, I'll kind of tag team with Gitanjali on some of the questions in the chat so far. So the first question is, can you clarify which specialties are required to use the tools? Does it include the ABA providers? So I'll hand that over to Gitanjali to answer.
Great question. As of now, given the information that we have in the BHN and the draft APL and stuff, it does not apply to APA providers, no. It only applies to mental health providers. I would assume psychotherapy and psychiatry is what is included.
Great, thank you.
Mm-hmm.
Okay, next question. Are members and beneficiaries on the same referral list, or are they two different lists?
Can we maybe clarify that question?
Yeah, let's see, that was, who was that? Oh, Queen, can you clarify that, please?
Yes, I want to know, so there's the, you said in the beginning that there are beneficiaries and there are members. Are those two different lists of patients? Are those two different panels?
Well, they're the same person, but yes, so if they're receiving non-specialty mental health services under the managed care plan, they typically refer to them as members, whereas if they're receiving services through the mental health plan, so specialty mental health, they're considered beneficiaries.
Well, my question is are we as clinicians able to receive members and beneficiaries?
Yes,
So we would get referred either or based on what they need.
exactly, yes.
Because in the old days, it used to be Contra Costa Health Plan had a separate mental health panel from the Medi-Cal panel. That's no longer.
So
I believe you are right, Queen, and correct me if I'm wrong. I believe you are correct. So I think members and beneficiaries are terms used by CCHP or the mental health plan. It essentially refers to the same people that we serve. So if you're contracted with CCHP, then you would receive non-specialty mental health referrals. And if you're contracted with the mental health plan, I believe you would receive the specialty mental health referrals.
So there are still two panels. And if you want to get the non-Medi-Cal recipients, you have to get on a different panel?
Yes.
Yeah, so CCHP has, I guess, two lines of business. There's the commercial line, which is for county employees and you know, folks who opt into that commercially. And then there's also the Medi-Cal managed care clientele.
Right. And my question is how do you get on the commercial panel?
You can contact CCHP member services.
You have to do a separate, you can't, if you're on one panel, you have to do something separate to get on the other.
Yeah.
Okay.
Okay. All right. Let's see here. So the next question, are clients screened as being
Katie, I apologize, but can we just go back to this question? Because Queen, I want to make sure that I understand the question, but also want to provide, you know, clear communication. These screening and transition tools would not apply to commercial members. Okay, so these are for Medi-Cal beneficiaries in what has historically been called the non-specialty and specialty mental health sectors. The irony of this conversation is that we have to refer to specialty and non-specialty to kind of like make sense of this, when in actuality, the intention of No Wrong Door and some of these products is to kind of blur that line, right? But that's the framework that we have, right? And so, yes, there are separate networks between specialty and non-specialty, but many providers are contracted in both. And so it's a VEN, but I think that the commercial question is a separate one when it comes to the use of these tools.
Okay, my question, and I just want to know how to get on the commercial panel, because I've been on the CCHP Medi-Cal panel for eons, and I just want to know what to do that.
So I would be happy to follow up with you if you want to drop your email in the chat, and we can look at your CCHP contract to ensure that, you know, we're aware that you are interested and have the capacity to receive referrals from either of our commercial members or our Medi-Cal members.
Thank you so much. I'm putting it in the chat.
Excellent.
I think, Jack, did you have a question?
No, I thought I might be able to help out since I just joined the commercial plan recently, but I don't have that much help to offer, so I'm okay. Thanks.
Okay, thank you. So the next question, are members and beneficiaries, oh, we already did that one. Okay. Are clients screened as being moderate to severe, no longer being referred to non-specialty providers? Gina, you want to take that one?
Oh, I'm sorry. Yes, hold on one second. I was just posting the attestation in the chat, so I apologize. What was the question again?
Oh, okay, let's see. Are clients screened as being moderate to severe, no longer being referred to non-specialty providers?
So again, it is kind of, we alluded to in response to the last question, with our CCMHP providers, you are currently providing services to both. And so nothing will change in that way. And that's where I mentioned, if there is a change in symptoms, but you are continuing to see that individual, even though they may qualify for another delivery system of care, you're continuing to provide it. And you're able to, on the network, on our network, to continue to do that. So it's pretty much business as usual, even if they have changed. Now, if their symptoms change, you are going to continue to see them, but they need an added service. Then you may need to complete a transition of care tool for that new provider in the new delivery system. But as far as if somebody changes, you don't have to discharge them if you're willing to continue to treat them.
I think that there's nuances both if you're the provider who has the established relationship prior to the need for a transition, and or the receiving provider for a member who may be receiving services in the other sector, right? So historically, if you were a therapist in the non-specialty mental health sector and a member approached you and they said, I'd like to establish therapy services, I'm already seeing a psychiatrist in specialty mental health, that might throw up flags or concerns, right? You might be like, well, I'm sorry, I can't provide you services because you're in specialty, and so you have to see a therapist in specialty, and I'm not contracted in specialty. In this scenario, if you feel like there is a match between the services that you're able to provide and the needs of the member, you can go ahead and see the member as they are, right? And not have to worry about, you know, the administrative background in this process. And to facilitate that transition or those additional services, we are expected to communicate these transition tools. But really, it's, you know, if they come directly to you, green light.
Thank you. And Renee had asked this question because Renee, you noted it's been over a year since you received a referral for a client who is mod severe. So like Gina said, this doesn't change the process of how you get referrals. You know, again, most clients are coming through access. You might have clients, you might have clients who are returning to you and just kind of, you know, call you, or just clients who find the member directory and call you directly. So that doesn't change. The front end process, though, at Access is typically if a member has, excuse me, moderate severe needs.
No.
Oh, let's see, Don, I think can you go on mute? If the member has moderate severe needs, they're typically being referred to the specialty mental health clinic on the front end. Sometimes, you know, if they have an existing relationship with you or they call you directly, you might see them. But it's not as typical on the front end that we're going to refer a moderate severe member to a network provider. What's more common is that they establish care at the clinic and maybe they kind of get stabilized a bit. And then they might do kind of what we call concurrent care. So they might stay open at the clinic for like med management, but then we might also refer to the network for therapy. So that's kind of more common as to why you might have a mod severe client on your caseload. In your follow-up question, Renee, so an example, if you wanted to refer a client to see a psychiatrist, would you use the transition of care form? That's a great question. So if the client continues to be mild to moderate, you know, non-specialty, then you could just, that's that's remaining within the MCP. Okay, if their acuity is the same, so then you just refer to access as usual. You know, we can get the psychiatrist on board that way via our network. If that client has now shifted over to the specialty side, they're moderate severe, they've declined, you know, they're a bit more impaired, you think they need that higher level of care, but you want to continue to see them, that's where the transition tool comes into play. That's concurrent care. You're going to still see them and you're going to refer to the clinic. Yeah, it's really these use case scenarios have grounded us. So it really helps, I think, to talk it through. And at the end of the day, that's why we say consult. We don't want you to spend, you know, 15 to 20 minutes filling out this form just to be told, oh, you didn't need it, or, you know, that type of thing. So it's always, we're always here to consult.
Renee, my 2 cents on this example that you just provided, if this were to happen, you would just call Access Line and you would consult, like Katie said, and then they will help you decide if they're able to provide the services within the same system. You may not even have to fill out the transfer form, right?
Yeah, exactly.
Irrespective of the level of care.
And I think it was Diana had a question about, in a recent newsletter, I read that we're no longer to send faxes regarding cases or referrals. And Gina said that we can fax on one of the slides. I think you're referring to CCHP has the health plan has made a big push to streamline and have all providers submit their documentation, referrals, requests through portal. On the CCMHP side with CMU, we've really done the same. I think we have like Gina, maybe 85% portal usage rate. What we're referring to, until we get this built out in portal, we're hitting some snags, we're trying to figure it out. We're kind of saying business as usual. So there's a small population, what we call the community provider network. There's some contracted federally qualified health centers, so that like doctors' offices where they have behaviorists who provide short-term clinical care. There's a few of those on the network, like La Clinica, Brighter Beginnings, Brookside. They faxed us their referrals. It's just old school. So we're saying for now in this interim period, you know, however you need to get us to that, get those forms to us, you know, do that. So we're not advocating for faxes, but, you know, we'll accept the few that come in.
Yes, and that's just another important plug. If you're not currently in provider portal, you know, definitely reach out to us and hopefully we can get you connected. I know in the very beginning, some providers had some difficulty and then just decided, you know, it wasn't for them. There have been a lot of improvements over the years. And so definitely if you're not currently on portal, reach out to us and hopefully we can get you in there.
So does everybody have a kind of a good takeaway as to how this applies to you, what this means to you, what forms you're using? Kind of so, Renee. Yeah, we've been working on this for months to try to distill and simplify and really figure out what's in scope for you as providers. You know, so just let it sink in. Like Gina said, we'll send a PowerPoint. There's some additional resources, you know, that you can tap into, and then ultimately just consulting because it's new for everybody.
Yeah.
Make sure you do that attestation. We have to show this is part of our state required behavioral health quality improvement plan, where we have to have deliverables. So March 1st, 2023, we have to send in what percentage of our providers, including our county system of care, have completed the training. So please make sure you do that.
Definitely. And I'll leave it, you know, we'll keep this open for a few minutes after even, just to make sure everybody does click on it. I know I've been in training sometimes and I go to click and then they end the training. So make sure you're clicking in there now as we're talking. So you don't lose a link. Although, as I mentioned, this will be for our network providers on our CMU webpage. And so if for some reason you miss the link, you can access it through the webpage. And I think too, just the bottom line to all of this is the state is just wanting to ensure coordination and that everybody's receiving, the best care that they can be receiving, which we already know, all of you as providers, that's your goal too. So this is just a way of more formalizing the process and making sure the collaboration, the communication is occurring.
Any final questions? If not, we'll give you a little bit of time to transition to whatever you have going on. I hope you guys have a great weekend. Happy holidays. Thank you so much, as always.
Thank you.
Thank you all. Have a great Friday and happy holiday.
Thank you.
Happy holidays, everyone.
Thank you. Always nice to see your faces.
Yes, nice to see you too, Renee.
All right. Bye-bye.
Bye.
Thank you.
Bye, Ann.
I'm sorry, is the attestation on the email where I clicked
In the chat. It's in the chat.
It is.
You have to go up a little bit more now. It's probably midway through the chat.
Okay.
It went out at 10:35. If you look for the time.
Oh, okay, there it is. Thanks.
Thank you.
I'm happy to hang back if there are other questions. Otherwise, Gina, I don't know if you want to stop recording.
Thank you. I'm not used to the whole recording function.